Welcome to Nutritional Medicine by Lab Analysis. I'm Dr. Cyrus Thomas, DC. I've been a chiropractic physician for many years, and I'm very pleased to be here today to present to you not only my views on nutrition, but the views of actually thousands of practitioners who share in a common view of this wonderful way of getting well. We're talking about doing medicine by nutrition instead of by pharmaceuticals for the most part. We're using lab analysis just as is done in hospitals around the country. Same analysis to determine what is wrong and what to do. We're using blood, urine, and hair analysis as well as saliva and stool to discover what is wrong, to make the diagnosis, and to treat the person. Our topic tonight is female hormones, and it's a great topic. We're going to cover a few basics in nutrition first before we get on to that. Smart medicine is nutritional medicine because nutritional remedies do work. We're doing a medical form of analysis, blood, hair, urine, stool, saliva, to come up with nutritional treatment. In the last 30 years, we've seen an explosion in nutritional knowledge. Nutraceuticals are medicines. They are complex molecules. The only difference is that they are found in nature and so cannot be patented for profit. Don't stop your medications when you begin nutrition. No one needs to be told to stop any drugs or treatments. Regular pharmacy medicines are called pharmaceuticals. Nutritional pills are called nutraceuticals. A nutraceutical in the World English Dictionary is another name for functional food. And of course, you've heard today how popular functional medicine is becoming. These are some of the medicines that we use in nutrition. And they're made by different companies, standard process. We have systemic formulas. We have creams and salves. We have more systemic formulas. Those are parasitic programs. These are other nutrients by another manufacturer. We all have our favorites, and as well as these. These are homeopathic medicines, and you'll see that we actually have thousands of those in store. Homeopathic medicines are great for treating any emotional component. It's also good to have a good homeopathic remedy working for you while you do the nutrition and while you wait for the nutrition to take hold so that you can stop the and reduce the pharmaceutical medications. Yeah, we must have thousands of these in the office. Pharmaceuticals give support, but once nutraceuticals begin to affect a cure, then the blood and hair tests will show that it is wise to reduce the pharmaceuticals due to their side effects. You will feel the difference, and you and your pharmaceutical prescriber will want to reduce your intake of pharmaceuticals. Now, I'm going to repeat this again because the entire show is really centered around this philosophy. Pharmaceuticals give support, but once nutraceuticals begin to affect a cure, then the blood and hair tests will show that it is wise to reduce the pharmaceuticals due to their side effects. You will feel the difference, and you and your pharmaceutical prescriber will want to reduce your intake of pharmaceuticals. But there's no rush. This can take time. In a blood test, most doctors order 26 different tests. We order 52. Then we color code them, yellow for warning, red for high risk, and blue is actually clinical or like code blue. Here we see these were the first results that the patient had when they came in. 6 months later, it had changed. Many of the reds had gone to yellow. Some of the blues One blue had gone to red, another blue had gone to yellow, and you want to go in this direction. So these were really excellent results that this person received, and this was specifically on a liver profile. We're looking at all the cholesterols, triglycerides, a thyroid profile. Further on down the test, we're looking at anemias, condition of the kidneys, etc. We don't use values. We don't say that you're okay if you're between here and here. We say that you're okay if you're between here and here. It's a much stricter range for really being healthy, because you can be in the purple zones and still be feeling lousy, and everybody's telling you that you're fine. This is the sample a sample of the nutritional report that comes back after we correlate the results with the blood, the hair, and the urine. You're seeing it on a computer screen, and we want to show you the different pages that are involved. Patient's name and information, of course. We go through their presenting symptoms, and this person had a lot of symptoms. We're looking at primary findings that are suggestive of these problems. We review their medications. We look at interpreting all the test results and blood lab results, coronary risk assessment, possible cardio effect. We're looking at a possible diabetic inflammation, anemia, possible infection, noted blood values. We're also looking at the hair for low chromium, high hair arsenic. This person had high hair cadmium, also lead, and high hair mercury. We look at all the hair values. We'll be describing those in a moment. We put a focus on diet. We tell people what they should eat given their tests, identifying low nutrient foods, diabetic recommendations, aerobic exercise, strength training, what kind of water to drink. They get a copy of their blood test to take with them, and there you can see the color coding. This is a copy of the hair analysis with the color coding. This person actually had numerous tests done over a 2-year period. Here we have the heavy metals, and a little further below we can see the mineral analysis of the hair test. These are the vitamin and supplement recommendations this patient received. Calcium, chlorella, some bioflavonoids, iron, magnesium, multivitamin, different types of omegas, powdered vitamin C, silymarin, stress B, sublingual B12, trace minerals, as well as vitamin E, 8 different types of vitamin E, and those were the number of pills per day that were recommended. The number of pills per day can be altered if a person has difficulty taking pills. This is a video of me in my office, and I'll play that for you just so you can see what that's like. Talking to a patient here, we have his report up on the computer. These are the homeopathic remedies in the background. The nutrients are out in the hallway in a cabinet. And it's important that each report that we give to a patient, that it is customized to that individual patient, so that they're not getting any kind of a rote recommendation, but it's a recommendation that relates to them specifically. There's absolutely no risk in this testing, unlike the risk that we have with x-rays and mammograms and CAT scans. Those all involve x-ray radiation. Exploratory surgery, of course, is a dangerous thing. Needle biopsy is said to possibly spread cancer during the process. Do your own research on that before you ever have one performed. And many doctors will test by prescribing a medication to a patient and seeing how well they do. It's a form of testing, and because of the side effects, it's not recommended. The hair follicle in every one of us has a little artery and a little vein going into the base of the follicle, which helps to create the hair shaft. Therefore, the hair picks up the heavy metals and the minerals that are in the blood, and by testing the hair, we can find out how the body is doing. A hair analysis shows us a number of heavy metals here like mercury, lead, arsenic, platinum, cadmium. It also shows us good metals that we need. So we don't want any of the bad metals. We want all of these to be on 0, but we do want a healthy amount of some metals and other minerals. So this is very detailed and individualized. The hair contains minerals and essential elements like copper, chromium, iodine, sulfur, and iron, 22 essential elements. It tests for 17 heavy metals like arsenic, lead, mercury, tin, and aluminum, and a blood test alone will miss completely all of those results. It just won't be there, and you'll have no idea how toxic you really are. The key points in this type of testing is that many more tests, including cancer markers, are performed, and a healthy range is created. That's that healthy range in the center that we would like people to be at. Lab results are compared with the results of other patients, thousands of other patients, and it also compares how well that patient did on nutrients so that you know which are the best nutrients for you to take. If you go into a health food store, there's 2,000 nutrients there. Which are the 6 or 10 that would be ideal for you? That's the question to answer. Also, when you do follow-up studies with this method, your new results are put into parallel with the old results, and you can immediately see what has improved and what still needs work. If you were to design a better system of doing health and medicine, could you? The results speak for themselves, of course. You are welcome to visit my website and read the case examples of how well people did at www.alternativeIntegrative medicines with an S.info. We'll give you that at the end of the show as well. We like to look at x-rays on people if they have them already, and for looking for all kinds of bone anomalies. And that's just another look at where I work. I really love my office. Chiropractic table for chiropractic manipulation, and we do all the consults over there. We go over x-rays with people, so if you have x-rays or MRIs, you can go ahead and bring them in. I'll explain them to you and tell you what the findings are. You probably will have a number of questions, as this fellow did, and I will describe the anatomy to you, and so that you'll know how you're doing. We do this for chiropractic cases. We do this also for non-chiropractic cases. If people have x-rays and they're doing nutrition only, we encourage you to bring x-rays in from another practitioner, and let's get a full view, a holistic view of how you're doing. So tonight we're talking about female hormones. There's a number of glands in the body, endocrine glands that make hormones, the ovaries, the adrenals, the pancreas, the thyroid, the pituitary gland up in the brain, and of course in the male it's testicles are involved, but we're doing female hormones tonight. When we work with somebody, we have to know basic medical elements such as blood pressure. Everybody needs to know what their blood pressure is. It tells us how hard the heart is pumping and how much it can relax in between strokes. So we listen to the heart for murmurs, and murmur is actually a backwashing through a valve that isn't either positioned correctly or that is malnourished and not doing well. Some B vitamins can actually help restructure the heart because of its own skeletal architecture, change the shape of the heart, and valves can reposition. We look in the ears of a patient because a lot of times there's wax buildup. We can also look for infection behind the eardrum. We do an eye exam so that in the eye exam we're actually not testing for vision. We're looking at the condition of the arteries in the very back of the eye to see if there is atherosclerosis or arteriosclerosis, hardening of the artery. And we do an exam of the oral cavity as well. So we ask him to give us a big ah. And we ask patients about their dental history as well. Hormone imbalance starts with nutritional deficiencies and excess toxins. Testing blood chemistry imbalance is where we start. Hormone imbalance starts with nutritional deficiencies and excess toxins. Why is that? The level of heavy metals in the body, the number of free radicals, and the mineral balances are key. So why? Well, it's a method that is holistic and naturopathic in its approach to the treatment of rebalancing hormones and allowing their formation and clearing pathways. Okay, so free radicals will block pathways, will block molecular sequential pathways that need to take place. Free radicals get in the way of that. They also occupy receptor sites on the outside of cell walls. We also we want to clear those toxins from the body. To form hormones, we need the right amount of fats and we need vitamins and minerals to do that as well. When those become deficient, we can't form the hormones that we need and our numbers will be low. So we're using the best that modern medicine has to offer in evaluating. And for example, to find out what a woman's estradiol and progesterone is, we can take a few different ways of going at that. A lot of people like to spend a lot of money and map the woman's hormones over a month's time. I do that as well with saliva testing. And it's nice to know where it's wrong. But just knowing where it's wrong doesn't tell you what to do. It's actually much more economical to do the basic blood test, the basic hair analysis and urine analysis, find out what other organ systems are suffering nutritionally, fix those nutritional deficiencies, remove the toxins that are in the way, and the chances are very great that the hormones will come back into balance by themselves. So beware of doing too much testing when you want to correct female hormone problems. Go to the basics whenever things get confusing. This was a case of a patient who in just 3 months, their night sweats were gone, their weight stabilized, their hives were gone, their appetites returning, and they stopped taking Xanax. Now, when all of this can take place, don't you think hormones are going to automatically come into balance? And in 9 months, their anxious feelings dissipated, the blood pressure was back to normal, their hot flashes were significantly improved, shakiness had subsided, and they were off all of their medications. So things were going well for this individual. This is the ovarian cycle. This on the top half, and this is the uterine cycle and its phases on the bottom half. We can see in the ovarian cycle that follicle stimulating hormone comes to a big rise. That's ovulation. Later on is, of course, menstruation starts this and menstruation ends, and we have a proliferative phase where the ovary is developing the egg, then the egg is released, and it's thinking it might get impregnated. And if it doesn't, of course, Menses comes around and starts again. All of this can be mapped, and we can know what all of the hormones are doing. There's a lot of chemistry into the formation of hormones, and a lot of hormones actually stimulate the formation of other hormones. So hormones come from the pituitary, stimulating the ovary. Those hormones go out into the body, and they have a negative feedback that tells the body how much to make and what a normal balance is. Hormone replacement therapy only encourages the body to enter an artificial chemical landscape and to actually stop producing any of the same hormone being prescribed, since the body is already receiving it in pill or cream form. Think about it. If you're trying to get the body, encourage the body to make more of its own hormone, and you give it the hormone that it's low in, sure, you're going to feel better immediately, but the organ that made that hormone is going to say, why should I make any more? It's already coming in from the outside in pill form. I believe in 20, 30 years, hormone replacement therapy will largely disappear. It's hard to substantiate. Testing for hormones. We can measure all of the blood hormones. We can measure exotic precursors to hormones. That means measure the molecules that become hormones. We can do salivary testing to map the monthly hormone cycle, which is a good secondary step to take if the primary step didn't already work. We suggest leave the above to clinicians. Clinicians are people who work in laboratories. Doctors should measure instead organ system function that indicates vitamin and mineral health and toxic load, and the toxins that block hormone production. Cheaper, quicker, easier, more fun, and less mystery, and a faster direct route to cure. We should find the culprits of chemical imbalances, which are often heavy metals in the cells and an imbalance of minerals in the body. Minerals are natural tranquilizers, and heavy metals are toxins that interfere with chemical reactions. Doesn't it make more sense to treat the problem on that level? A hair analysis will identify the mineral imbalances and the level of heavy metal toxicity. When we do integrative medicine, of course, diet and lifestyle are important, and lifestyle changes may be blocking any progress, and diet plays a large role. We take all of this into consideration when determining all possible causes, but even when there is stress in our outer lives, a chemically balanced person can handle most stress physically and emotionally. So we can't just blame stress. We should be able to handle stress. We can't just blame the genetics of our forefathers. We need to be healthy. We need to do whatever it takes to get healthy. Harmful foods, of course, are wheat and sugar. Many of us, 95% or so, have gliadin, gluten intolerance. Sugar is such a destructive substance. For example, if you take blood vessels and put them in a test tube and add sugar, the blood vessels will begin to make bone. Now, when blood vessels are making bone, they're actually cementing. And this is what arteriosclerosis is, hardening of the arteries. Sugar contributes. In fact, most liver lipid profiles that are all off, all the cholesterols are off and people are taking statin drugs, most of all of this can be documented as and proven to be from mostly sugar in our diet. Our American diet is very high in carbohydrate. Healing strategy. Eliminate sugar. If it's hard to do, of course it's hard to do it slowly. A diet adjustment, cessation of eating flour and sugar, adding nutrients for healing, taking nutrients each day to make up for the fact that our food is not the way it used to be 100 years ago. Getting a multivitamin and mineral tablet, balancing the thyroid, the adrenals, live metabolism, eating fresh foods, green foods, and taking probiotics so that the intestinal balance of flora and fauna is good enough to deal with what we're eating. In fact, all of the fiber that we eat in vegetables needs to be turned into fat, and it is a type of bacteria that does that. It actually turns it into fat. Most people don't realize that. Most trends are asymptomatic. We have to practice prevention. What this means is that as a person is getting sick, he doesn't have any symptoms. He doesn't know he's getting sick. So somebody says, I feel fine, should I do testing? I said, well, let's do the test and find out. And invariably, when we do the test, we find a number of items that the person is moving towards in sickness, and we can start to prevent them from actually becoming symptomatic by treating the ailment before it ever gets there. There is also masking of symptoms. A constant symptom makes us lose conscious awareness of pain. So if you have a symptom that's going on constantly, you can not feel it anymore. And so you lose a conscious awareness of that pain. You get used to it. When you start getting well and you feel better again, if that pain returns temporarily, you're going to really know it because you're no longer going to be used to it. The solution in dealing with masking of symptoms is to do the testing. IntegrativeAlternativeMedicines.info. It's a nice website. I've got a lot of these shows are archived there, so you can go there. This is my office on D Street. Also, there's a number of articles, and you can read case histories on about 20 different diseases on the website. So if you're wondering if this method can handle or treat your ailment, go here and take a look. A Code of Honor by Dr. Van Merkel it's a code that all physicians should adhere to. It is an awesome responsibility and humbling when a patient comes to us. We have to do our best. We must not be distracted. We'll not order one test or recommend one vitamin more than is necessary. But neither shall we shirk from our duty of telling a person everything they need to do to really get well, and not just make it, not just candy coat it. Without health, how can one fulfill their ultimate potential or purpose in life? Changes to nutritional prescriptions. The American Heart Association used to recommend a 55% carbohydrate, 30% fat, and 15% protein diet. Not anymore. What we thrive on is 65% fats, 20% carbs, and 15% protein diet, and it's easy to prove in an abundant number of university studies. Future programs here will deal with this topic. We'll be talking about it in detail here. Max Planck said that scientific theories don't change because old scientists change their minds. They change because old scientists die. And it will take a few funerals yet before official recommendations are updated to what they should be, to what the studies are actually showing they need to be. Special thanks to the people who put this show together, especially to Vita Flores and Brad Flaherty. Give me a call if you want to talk about your ailment, your condition. I'd be glad to let you know whether I think this type of therapy could work for you. Also want to thank the Community Media Center of Marin for allowing us to do this program. This program airs every Tuesday night at 8 o'clock. Hope you'll watch it. For people who can't watch it, simply go to the website and you can see it. You can see shows there. Thank you for watching, and may you be in good health.